extremely happy today to welcome Anson McCall to provide some valuable donation to the Ministry of Health. Mr. Troy Cadogan, Managing Director, and Ms. Dad, his former head of pharmacy. The ministry is very proud to always work with the private sector in the fight against COVID, and this collaboration is a significant step towards that support that we need as a country to move forward. Uh, as PS, we always happy and welcome the support of the private sector, and we look forward to future collaboration like this going forward. I'll now pass it on to Mr. Cadogan to say a few words on the donation to us.
We're one of the private sector companies that normally supply the government of Guyana with pharmaceuticals. During the fight for COVID in the earlier stages, a lot of the companies would have donated masks and PPE towards the ministry, and we were also in this initial donation period. But I decided to reach out to some of our suppliers and solicit what can we do to help from a pharmaceutical part of this, to help with stemming the death rate of COVID and the impact of COVID on the Guyanese society. And a couple of our suppliers reached out to us and said, there's this drug around the world that seems to be working, Remdesivir. Um, and we started the process. I spoke with the minister in the earlier stages after we will accept it. And he said it's part of the treatment protocol in Guyana. So I signaled to the suppliers to send it in. So this was a collaborative effort between the minister and myself in terms of bringing this donation. So this is the first batch of 100 vials, and we have a second batch of another 100 vials, which will be with us over between the next weekend. So basically, the donation is 200 vials, and it's a substantial, mind you, a substantial donation towards the government of Guyana, people of Guyana, from Anson McCall.
We want to say how grateful we are to you and your company for this donation. As you rightly said, we have been using Remdesivir now as part of our treatment protocol, and especially for those patients who are in our ICU. And this has now become one of the important components of treatment. Now, while I know you said it's very expensive, the challenge that we have is that sometimes for one patient, we have to use 10 of these for the course of treatment. So it is timely, and I'm sure it's going to help some of our patients. COVID-19 has shown that once we come together as a team in the country, whether you're in the private sector, public sector, we all have to work together to ensure that we have control over COVID-19. Some partners are better at other things than others. So, for example, you have been able to leverage your expertise in pharmaceuticals to bring this for us. Others maybe have their expertise, say, in PPE. But whatever it is, we need that type of collaboration and cooperation so that we can provide the optimum care for patients who would need this assistance. Of course, while we work on the treatment side of things, and we've gotten better because we've been able to now equip our ICUs with ventilators and oxygen concentrators, so the equipment that we need, we have that. The meds now, I'm happy that we're getting some more Remdesivir and other drugs so that it is available. If somebody really gets sick and they need this care, that they're able to get the care from our ICU. And we have been training our doctors as well. The level of care that we're providing at GPHC, we're also extending that to the regional hospitals so that if you have persons at these hospitals, go to these hospitals, then they'll also be able to receive similar type of care that they can get at GPHC. So it's a work in progress, and with your assistance and with other companies similar to yours, I think we can even get better at what we are doing. We also want to perhaps ask you, with the kind of leverage that you have too in the private sector, that we need more people to add their voice in terms of the preventative measures. And I'm sure your company has complied with all the regulations and guidelines that we have put out, but we want you to use your influence to get other companies, to get maybe persons who you interact with, your customers, to understand the importance of mask wearing, sanitization, keeping social distance, and so forth. Because while these might look like simple measures, they actually help to prevent infection. And if we can prevent infection and reduce the spread, then we'll have less cost to use things like Remdesivir. So again, thank you very much for this donation, and we look forward to the second batch.